Healthcare reform under siege. The lion machine, the big insurance lobby, is killing the public option, or is it? Here's what's happening with latest surveys. Righty talkers and Republicans are spreading lies and misinformation, and they are sinking in with Americans. Take a look at these numbers from a new poll commissioned by Indiana University. More than half of Republicans believe in death panels for the elderly. 2/3 of them believe a public plan would cover all illegal immigrants. And roughly 3/4 of them believe it will lead to rationing and taxpayer-funded abortion. Wow. Many Republican voters are hearing this garbage straight from elected lawmakers, so maybe those numbers aren't a surprise. The really alarming numbers are with the public option. A majority of Americans don't believe in the basic principle of having a public plan, that it would lower costs for everyone. 51% believe it would increase health care costs. 54% say it would drive up the cost of private insurance premiums. And 56% believe the United States cannot afford to pay for it. Joining me now is Dr. Aaron Carroll. He's the director of Indiana University's Center for Health Policy and Professionalism Research. He's also the author of Don't Swallow Your Gum: Myths, Half-Truths, and Outright Lies about your body and health. Dr. Carroll, good to have you with us tonight. I appreciate your time. What jumps out at you at this poll? And I know it's extensive research on the university's part. What jumps out at you? What really surprises you?
I think it's not necessarily how many Republicans believe these things, but how many people overall. More than half of Americans believe so many of these myths that it's really quite clear that the administration and Congress just aren't getting the message out about what health care reform is really going to do.
Can we come to the conclusion that independents now are going to decide this health care debate in this country? Are they the key sector to watch?
I think it's likely so, knowing that there's only about so many Republicans and so many Democrats and now just about as many independents. Looking at how many of them actually believe these myths, I think that they're really someone that the administration and Congress has to target if they're going to turn this around.
Now, well, that's the question. I mean, how would the administration turn this around? I mean, these are big numbers. Would you say that? I mean, would you agree that these are big numbers to defeat at this point?
I think that they are big numbers, but the numbers have changed over time. I don't think it's lost yet, and I think that with a good message and a big speech or a really concerted effort to be very consistent with their messaging, I think they still can turn this around.
58% believe taxpayer-funded abortions will take place in this country. What was the question? Was it just a direct question in this survey?
It was. It basically said, if the reforms pass, will the federal government pay for abortions, or would the health care reform pay for abortions? It was very non-judgmental one way or the other, just asking if they believed that the reforms in the bill would actually cover abortions, and people do.
Now, Dr. Carroll, I know you've done a lot of these surveys before at Indiana University, but if you could judge how anxious people were to talk about this, how eager they were to talk about it, how willing they were to participate, and maybe how focused they are on the issue. Give us a sense.
People are really interested in talking about these things, and they're very vocal, either for or against. We had very few people who were non-committal, one way or the other, on almost all of these questions. Everyone had an opinion.
Everybody had an opinion. It's pretty amazing stuff. Dr. Aaron Carroll, I appreciate your time tonight on The Ed Show. Thanks so much.
Thank you.
All right, let's bring in our panel. Laura Flanders, author of Blue Grit and the host of GritTV.org. She joins us tonight. Also, Sam Stein, political reporter for the Huffington Post, and Republican strategist Ron Christie is with us tonight. Laura, we'll start with you. The independents, those who were sitting on the fence that ended up voting for President Obama, where do you think they are right now, and how troubling is this survey?
Well, I have to say, given the onslaught from people, I don't know, the thuggery that's been out there, I'm astonished as many people still have their heads screwed on as do. And let's remember, those independents are the people that came on board with Barack Obama when he talked about, well, he talked about his mother. He talked about people dying because our healthcare system is driven by profit as a priority rather than people. That's what he needs to go back to. And I think if he does that, he'll have them back in his camp again.
Ron Christie, have you ever seen anything like this in your political career? That you have to admit, Ron, that there are a lot of things that are being spewed out there that simply are not true, and yet so many people are believing what is being broadcast and the conservative, torpedoes that are in the water constantly at the Obama administration. What would you compare this to?
The only thing I think, Ed, that I can compare this to is where we were in the middle part of the 1990s when the Republicans were trying to slow the rate of growth of Medicare, and you heard that we were going to leave senior citizens withering on the vine and that the Republican Party didn't care about the elderly. I agree with you. There's a lot of misinformation out there, but let's just stick to what we do know, Ed. You look at the number where it says that 56% of the American people don't feel that we can afford this. I believe that. The president said that he was going to have a bill that wasn't going to raise taxes by a dime. We've seen that the 4 bills that are going through the Congress are going to cost at least $1 trillion. And the other thing I might say, Ed, is the fact that you had the mid-session budget review that came out today that said the size of the deficit is going to increase by $2 trillion. I think the American people, 56%, recognize the government spending an awful lot of money. Can we really afford this at this point in time?
What about that, Sam Stein?
Well, what about Ron's point? I mean, I think Ron sort of illustrated what is a little bit of a disingenuous argument in this debate. He mentioned that the health care bills are going to, that the president has pledged not to raise taxes, but that these bills are going to cost $1 trillion. Well, the president has actually insisted that he doesn't want a bill that raises taxes on families who are earning under $250,000. One other point I'd like to make, though, is that there's really no penalty for throwing out disinformation from conservative lawmakers or Republican lawmakers. Senator Chuck Grassley has accused the Obama White House of wavering on the public plan. This is the same senator who insisted that the government was going to pull the plug on grandma, then equivocated on Sunday, now is pushing it again. There's literally no penalty for throwing out mistruths, and I think that's what you're seeing here.
Ed, can I respond to that very briefly?
Go ahead.
The fact of the matter is the Congressional Budget Office, which is nonpartisan, said that the bills that are going through the Congress right now that the president said that he has endorsed would cost over $1 trillion. That's not a myth. That is a point of fact.
If you don't raise the taxes, though, Ron.
Let's go back to what Joe Walsh said.
That's if you don't raise the taxes.
Okay,
if you repeal the Bush tax cuts,
let's take the taxes out. Let's stick specifically on the numbers. It is a point in fact that CBO said that it will cost $1 trillion. Let's take taxes off of it. How are we going to pay for that?
Costs $1 trillion. We're talking about a priority of what the American people want. Iraq cost $1 trillion. Nobody threw the red flag up on that over on the conservative side.
Let's stick where you were at the beginning of this program with Joan Walsh. The water is turning. I really believe the tide is shifting in favor of those who actually want reform, voted for reform, worked for reform, and are shocked that there are very rich elites in this country who would be willing to scuttle this once-in-a-lifetime chance for real reform because they're scared that somebody might touch their profits. People are waking up. They're not only going to these town hall meetings and matching the right one for one, but they are getting their representatives to pledge that they will not vote for anything that doesn't have a public option.
And Sam Stein, I want to approach you on these numbers from Indiana University, which are very accurate. They've done and have a history over the years of being accurate in their surveys. What does the Obama White House have to do right now to combat these lies? I mean, the president being on vacation, I mean, everybody needs their time off, but what do they have to do to turn the thoughts on death panels around, covering illegal immigrants, ration care? You could make the case that we've got ration care right now and taxpayer-funded abortions. What about all that?
I mean, if there was a solution, I think they would be deploying it. This is what I'm getting at, is that there is no penalty for a Sarah Palin or a Chuck Grassley to get up there and say that this bill will pull the plug on grandma. I mean, as much shame as these people get in the media for telling mistruths, that's it. And they, in turn, convince the public. I know that 50% of Republicans in this Indiana survey still believe the death panel myth. I mean, that's been debunked to no end. So the White House is really devoid of options here, other than to keep reminding people that this is not the case. There's really no game changers, and that's what's haunting the White House right now.
Let's bring more people into this conversation, Ed. Let's bring the people in who know that their families are hurting, who know that their economy is tanking.
So tell the personal stories.
I want you to bring in the personal stories. Let's have them here at the table alongside these politicians who are just scoring points by killing our chances of change.
That's been a tactic of the White House from the beginning, to tell personal stories, and it's only worked to a certain extent.
Well, personal stories are one thing, but I certainly would like to hear these lawmakers debunk this. If you guys say that all this is a lie and it's not true, let's look at it. It is a truth fact that people who are in this country illegally go to emergency rooms right now and receive medical care.
But they
let's
also
make sure in a new bill, Ed, that they don't.
But they also get a bill, and they're expected to pay, and we don't deny anybody in this country, but that doesn't mean that they're not going to get a bill when they leave. But Ron, I have to leave you with this on this segment. It would be good if the RNC chairman would at least send a clear message on where he is on Medicare, because what I played in Psycho Talk, I mean, these are two totally different messages that the Republicans Republicans are sending out.
It would also be great, Ed, for the American people to hear some straight talk from the President of the United States and members of Congress about what they're going to do for Medicare.
Well,
they said that they wanted to cut millions of dollars in Medicare, and yet they weren't going to reduce care. Ration care is coming. No. They need to tell the truth.
It's ration care right now, Ron. You've got denying of coverage and denying of premiums being paid, claims being paid out. That's rationing. Insurance companies do it right now. We'll come back with our panel. I got to run here. I'm up against the clock.